Hello, my name is Candy Wright. I'm the Director of Cardiopulmonary and Wellness here at Cleveland Regional Medical Center. What I'd like to share with you today is some of our services that we have here in these departments. Those three departments include Cardiovascular Center, which is a cardiac cath lab and a vascular lab. We have the Cardiopulmonary Department, which is testing cardiac and vascular and pulmonary procedures. And then we also have a cardiac and pulmonary rehab program and also a wellness program for our employees here at Cleveland Regional. In our Cardiovascular Center, there we house two labs. One of our labs is to do heart catheterizations. Our cardiologists perform these. It takes approximately 1 hour, and what we're looking at is to see if you have blockages or any abnormalities in the cardiovascular system of your heart. If we see that there's additional services needed, we have a direct line within our Carolinas healthcare system that we can get you to additional services as needed. In the vascular lab, we perform procedures that relate to your legs and your arms and looking at blockages that you could potentially have in your lower extremities in particular. We have two board-certified vascular surgeons who perform these procedures, and they can take care of interventions such as stents or angioplasties or the balloon procedure, where we can open up those arteries to help increase blood flow for our patients. Within our cardiopulmonary department, we do numerous numbers of tests. One, with our heart patients or cardiac patients that we do various types of cardiac stress tests. That is where your physician or one of our physicians is concerned that you could potentially be having an issue with your heart. We do a non-invasive stress test in there, and to determine if we're seeing any potential blockages or problems that we need to investigate further, such as moving on into our cardiac cath lab. Additional procedures we do is called echocardiograms, which are ultrasounds of the heart. There we can look at the actual muscle of the heart and determine how well the mechanics are functioning of the muscle within the system. Additionally, we also perform EKGs, which are your standard just electrocardiograms, which is just looking at electrical activity within your heart. It takes 5 minutes and it's non-invasive. Our last procedure that we perform in there is what we call a non-invasive vascular study. And what we're doing is just like taking blood pressures in your lower extremities, in your lower legs, and what we're assessing is the pressures and blood flows so that to determine if some additional services are needed, such as when we move into our vascular lab to have a stent placed. The last test that we also do within Cleveland Regional Medical Center is called pulmonary function test. That is your lung function. We do those as outpatient and inpatient. It takes approximately 1 hour. It is non-invasive, and we're just assessing lung function of many of our patients. Last, we have just opened a 9,000 square feet Cardiopulmonary Rehab Wellness Center. Our focus within the T.R. Harris Wellness Center is twofold. First, a cardiac and pulmonary rehabilitation program, and secondly, a wellness program for our employees here at Cleveland Regional. With our cardiac and pulmonary rehab program, we are rehabilitating patients that may have had a heart event, such as a heart attack or other procedure, or patients that are having difficulties with their lungs, such as emphysema or COPD, and we're helping them to rehabilitate the activity and increase the quality of their life by promoting wellness, promoting nutritional counseling, and exercise. We have exercise physiologists who work to establish a training program to help them to be healthier individuals.